Hello everyone, good evening and welcome to Newsnight. Well, this bulletin is live on Joy 99.7 FM in Accra, Love 99.5 FM in Kumasi, and on over 30 affiliates across the country. Well, tonight, National Health Insurance Scheme sets sights on universal coverage as it expects all illnesses to be covered by 2030.
Every Ghanaian everywhere can actually access healthcare without financial hardship. And by 2030, we want to ensure that we have universal health coverage across Ghana.
We bring you details as private health insurance institutions demand telecommunication service providers to hold provision of health insurance.
Also coming up tonight, cocoa farmers welcome a 400 cedi increment in the producer price of cocoa, but lament that the intervention may not improve their welfare if the government does not intensify its crackdown on illegal mining in cocoa-growing communities.
We appreciate it. But the money has not been sent. They announced it, but the money has not been sent. So it's the old money that is in the system.
Galamsey is eating up our cocoa.
And also coming up tonight, Ghana Education Service takes swift action against a teacher at Okadjakrom Senior High Technical School in the Oti Region by interdicting him over alleged sexual misconduct with a female student.
Also on Newsnight, angry nurses and midwives take to the street once again to demand immediate payment of 10 months' salary arrears.
Why do you keep disrespecting us?
During the recent UN General Assembly, he made a statement that the slave trade is the greatest crime ever against humanity. I want to put it on record that what is being done to us is a modern-day slave trade.
We'll hear from the Health and Finance Ministries who say they cannot guarantee how soon the arrears will be paid.
We as a Ministry of Health will continue to work closely with the Ministry of Finance.
As to timelines, when your bank accounts will receive your salaries, I cannot stand here to announce it.
And coming up in business,
government promises to press ahead with programs aimed at improving the welfare of cocoa farmers after announcing an increase in producer price.
And later in sports,
boxing stakeholders vow court action against NHIS sports ministry over unconstitutional takeover of the sport.
We got the latest of these and many other stories coming up in the next 1 hour. You can be a part of this show by sending us a WhatsApp. The number is 055 11 11 997. My name is Kenneth. Gyasi.
And my name is Ofori.
Details after this. Hello again. Let's begin with health tonight because the National Health Insurance Authority has set an ambitious goal to cover all illnesses under the National Health Insurance Scheme by 2030. Well, the NHIS already covers 95% of illnesses and the authority plans to absorb the remaining conditions soon. Well, the Medical Trust Fund will provide a financial safety net, enabling the NHIA to expand coverage and improve healthcare services.
Speaking at a stakeholder engagement with private health insurance providers, Dr. Victor Bampo, who is the acting CEO of the NHIA, expressed confidence that the goal is achievable thanks to the establishment of the Medical Trust Fund and the imminent rollout of the free primary health care.
Every Ghanaian everywhere can actually access healthcare without financial hardship. And by 2030, we want to ensure that we have universal health coverage across Ghana. Starting off with the NHIA as it exists now, we nominally take care of 95% of all disease conditions. So there's the Mahama Cares, there's the regular NHIA, and then there's also going to be the introduction of the free primary health care, which is looking at diagnosing some of these diseases quicker, screening people, preventive medicine.
Let's go into the telephone lines right now and speak to Dr. Kwame Sapon-Esiedu with CDD Ghana. He's a fellow in public health. Doctor, thank you very much for your time this evening. Well, unfortunately, we've lost him on there, but let's try once more and see if we can get him. I understand he's on Zoom with us right now. Dr. Esiedu, I believe you can hear me. Thank you very much for joining us tonight. This is what the National Health Insurance Authority is saying, that they're going to cover all illnesses by 2030. Do you think this target is really realistic, especially looking at the current gap in our financial health financing and also infrastructure gaps? Kindly unmute so we can hear you. We're struggling to get to Dr. Kwame Sapon-Esiedu, who is with the CDD Ghana. He's a fellow in public health. Hi, Doc. I understand we have him back on the line. Can you hear me?
Yeah, hello. I can hear you. Can you hear me?
I can hear you. Yes, I was asking that with ambitious target that the NHIS is setting for 2030, where they want all illnesses to be captured under the NHIS. From where you sit, do you think it's realistic?
Yeah, like I was saying earlier, good evening. It's not about whether it's realistic. It's about what we signed up for. As a country, we signed up to deliver universal health coverage by 2030. And in signing up to deliver universal health coverage by 2030, we signed up to one fundamental principle, that finance should not be a barrier to access to health at the point of need. That is the fundamental principle of delivery of free primary health care. So if finance is not a barrier at the point of need, then it means that no disease technically can be excluded, because you cannot say this disease is too expensive, and as a result, you cannot fund it. So the strategy then comes into play, as in, what are you doing to ensure that these diseases don't bankrupt your health system? Because that's the other question you asked around, can we fund it? But globally, everyone who has followed healthcare knows that the strategy that countries that have been successful at this have used is to focus on preventative and promotive healthcare, which means that you go looking for disease in the community rather than getting people to come to the health service ill. So, for example, you screen people and all that. So if someone is known to be borderline hypertensive, you monitor them. Once they get hypertensive, you put them on a medication, which then means that their cost of management is low. That is where Ghana has failed. We have traditionally, since 1957, operated a curative model of healthcare, where our system is, you fall ill, you come to the hospital, you are diagnosed, and you are treated. Unfortunately, that model is dangerous when it comes to chronic diseases. And if you look at our current disease burden, which is doubling as a result of the chronic disease burden, that is why 40% of all our deaths are happening within the ages of 40 to 60 years, and only 3.8% of our population is above 65 years. So if the government is going to achieve that, then they have to roll out a preventative healthcare policy. So what do I mean by that? They need to be quick at rolling out the free primary healthcare policy, because that is where they are claiming that they are going to achieve preventative and promotional health. If they do that, then yes, they should be able to achieve it in 2030. Because 2030 is 5 years away.
And if they don't, what happens?
Well, if they don't, a curative health system would not suffice to cater for all the disease states, because it would bankrupt. Like I've said on numerous platforms and with things like dialysis, even the richest person, if you are told to pay for your dialysis and stay alive, it will bankrupt you. So if they don't roll out a system that goes fishing for disease states in the community, then the system is going to fail.
There has already been skepticism about the feasibility of this target. And of course, our NHIS was famously, modeled around the NHS in the UK. And a lot of times there's comparison between the two, looking at how the UK's own is flourishing, but ours seems to be, retrogressing as we speak right now. Are there some lessons that we can take from them or others who have successfully implemented universal health coverage?
Well, yes. The simple answer is the NHS has a basic slogan, from cradle to grave. What it simply means is that the health system takes care of you from the time you are born to the time you leave. How do they do that? I live in the UK. Once you hit your 40th birthday, you are sent a health check notification where you have to go and screen for a whole lot of things. That is what I was talking about in the outset about preventative and promotional healthcare. And there's a lot of advertisement going on about these things and why you have to screen and stuff like that. So yes, you would say that the NHIS is more advanced because it's been with us since 1948 and other things, and they've done this repeatedly. But if you go to Brazil, they've also got a model called Lice Medicus, which also is a similar thing. But the good thing about systems like that is when you implement them, you do not need high-level health cadres. What do I mean by that? Like doctors and other things to run it. A lot of the time, because you are diagnosing early, you can get physician assistants, nurse practitioners and other things to manage a lot of the chronic diseases, even pharmacists. Because a lot of health conditions now which are chronic in the UK are managed by pharmacists. I manage a lot of patients when I go into community practice who are on chronic disease medication. And it's nothing extraordinary to do. But what it does is it extends what we call the quality adjusted life years. What it means is of the number of years you would live, your life expectancy,
right?
The number of times you would spend in hospital decreases because you stay healthy for longer. So the quality of life that you get as a result of the system fishing for disease states that ordinarily might be hidden because they are asymptomatic. What we mean by, like, someone might have hypertension and might not know, and that's why we see a lot of people, we hear this thing in Ghana a lot, people around between 40 and 60 years. So there was nothing wrong with him. He said he was going home, he would be back, and next minute he was dead. The point is that the person might have had elevated blood pressure, high sugar levels, irregular heartbeats that they doesn't know. And all it takes is for one fluke to happen, and then they have a stroke or a heart attack or something and they don't survive it. But if you go fishing for these in the community, then you pick them up early, the people will be on medication. So these otherwise catastrophic health effects, which are, even if you survive, are very expensive to manage, are decreased. So the bill for the NHIS would automatically go down. That is what countries that have implemented this have seen. And there's a lot of data globally to support it, that if you do it properly, because your secondary and tertiary care costs are low, and the cost of primary healthcare management, basically when you say primary healthcare management, what it means is that you keep the people as healthy as possible for as long as possible in the community. So they are in their house, they go, they fill their prescriptions in the pharmacy, they take their medication, they do their routine labs, they are not clogging times in OPDs and stuff like that. The cost to the NHIS would be much lower. If the cost is that low, then what in return will happen is that they would have a bit more liquidity. So I don't see this as can it be done, because this is a global push. UHC is a global push.
Right.
And Ghana signed up to it. And so if you are asking me now, that is it feasible? The question I would ask you, or pushback I would give is, when our leaders were signing it, were their eyes closed?
That's a very interesting question you asked there, Dr. Kwame Sapon Esiedu. But thank you very much for your time this evening. He is a fellow in public health with CDD Ghana. Pell?
Well, Kenneth, speaking at the same stakeholder engagement, acting director of the private health insurance industry, Dr. William Okadjakrom, raised concerns about telecommunication companies offering health insurance services. He argued that the National Health Insurance Authority has not approved these services, stressing that such activities hamper the private sector's ability to penetrate the health insurance market.
There is a growing menace of some telecommunication companies partnering certain insurance companies to deliver some form of insurance that also includes a health insurance. these products that are being rolled out by these communication networks are not known to the National Health Insurance Authority. So the authority is sounding a strong caution to companies that are in partnership with these telecommunication companies that they must desist from entering into or offering products that has any component or semblance of health insurance.
Right, and away from the National Health Insurance Scheme, let's talk about cocoa, because tonight there's a wave of appreciation for government's decision to add an additional 400 cedis to the producer price for the 2025-2026 crop season. But farmers are already raising grave concerns over the continuous destruction of their farms by illegal miners. At the start of the season, farmers were earning 3,225 Ghana cedis per bag of cocoa.
Now, the addition of 400 cedis means Ghanaian farmers will now earn 3,625 cedis per 64 kilograms of bag. Speaking at an emergency press conference in Accra, the Minister for Finance, Dr. Kasia Latifosin, said the review will help improve the financial well-being of farmers.
We have subsequently conveyed that meeting, and we are pleased to announce a new producer price to take effect from tomorrow, Friday, the 3rd October 2025. It is my singular honor to announce that on the basis of the changes that we have affected to the forecast, the government has taken a decision to increase the producer price of cocoa to 3,625 Ghana cedis per bag, or 58,000 Ghana cedis per ton. This simply means that per every bag purchase, the cocoa farmer is getting 400 Ghana cedis additional. Simply put, to the ordinary cocoa farmer, since my last engagement on the 4th of August to today, every bag you will purchase, you will sell to Cocoa Board, you will be getting another 400 Ghana cedis, or 4 million Ghana cedis, old Ghana cedis. 4 million old Ghana cedis. We also want to bring to your knowledge that Ghana Cocoa Board will continue to implement all the interventions to support the cocoa production and the welfare of the cocoa farmer.
But the president of the concerned Farmers Association, Nana Boatin Bunsu, says the increment will not be felt until the government intensifies its efforts to flush out illegal miners in cocoa growing areas.
We first of all thank Honorable Latifosin and then the Cocoa Board and then all the management team for doing such a wonderful thing for we the farmers. But there's one thing that we need to look at. This is just a tip of an iceberg. There are a lot of things to happen because I know that the price will not stay like that. The price will go up again by next year, or maybe next year it will go up again. And one major challenge that it is eating we up is our cocoa is going, our cocoa is dying. That is what the focus has to be.
And what is influencing the death of your cocoa crops?
The galamsey is eating up the cocoa. As I'm speaking to you, this galamsey thing is eating up our cocoa. At the moment, we can enter a various cocoa farm that the galamseys have been digging down, and the cocoa trees is still standing, dying off.
Well, meanwhile, Secretary of the Asikaso Cocoa Farmers Association, Emmanuel Nojo, who welcomed the increment, says purchasing agents are yet to receive funds to pay cocoa farmers starting tomorrow when they bring in their cocoa beans.
We appreciate it because it means it's going up. Formerly, how we were expecting something big and it didn't come. But now that some money, something is added to it, it's going up, then we think that the government will be doing the same thing when the price is going up.
But you do have some concerns. What are these?
The government is supposed to send that money to the buying agents before they announce the new price. Because if the money is not there, and the farmer know that they have increased the price, he is demanding the new price. He
he's selling the cocoa for the new price, but that time too, they haven't released the new price to the buyers. So it becomes a problem. That's the issue. Because the government has to send the money to buy agents first.
And as we speak, those monies have not been sent?
The money has not been sent. They announced it, but the money has not been sent. So it's the old money that is in the system. As of now, I'm at a place looking for money to go and buy cocoa. But how much are they going to give me? The new price is not there now. And the old price, too, they can't even give me. The farmer will not accept it.
And let's bring you more on this because the Assistant Professor of Finance at Andrews University, Williams Kwesi Pepra, says the increase in price will incentivize farmers to produce more and reduce smuggling to neighboring countries.
So an increase is in the right direction. So the 400 cedis, if you check, it's at about 12.27%. If you look at that one and compare it to how the cedi has devaluated between August and today, which is about 11%, it's just to be able to cover that kind of devaluation. And in a way, it's going to motivate the farmers to produce more, which is going to incentivize them to produce more. So remember, as we were talking to the Cocoa Farmer Association member, he was very happy and he was talking about they are going to produce more. The 400 cedi is going to lead to overproduction, and that is another point. The third point is that the price differentials between Ghana, Togo, and Ivory Coast must be sustained. Currently, Ivory Coast, if you look at their per 64 kg bag, it's around 220,000 CFA francs, which is about 2,000 Ghana cedis per bag. So there's no motivation for someone to produce in Ghana and smuggle it to Ivory Coast. The price is just 3,600 plus. And if you compare to also Togo, where a lot of people also smuggle cocoa to, Togo's price is also below 2,200 Ghana cedis. So our price is way high. The advantage is that even those in Ivory Coast and Togo, if they are going to be rational beans, they rather will bring their cocoa beans to Ghana for us to export, and they'll get more money. So.
Right, so that's the Assistant Professor of Finance at Andrews University, Kwesi Pepra. They're saying that the new increment will incentivize farmers to produce more, and this is a sentiment that has also equally been shared by the Managing Director of the Cocoa Marketing Company, Wisdom Dogbe.
The sector minister has announced a new producer price with the aim of continuous improvement to the welfare of the Ghanaian cocoa farmer. Cocoa Board will provide more clarity on this, so I'll defer to them. That said, at CMC level, it's important to note that prices are impacted by market conditions. And when the minister assessed the market, the current market, he came to the conclusion that to better support our farmers, it is important to raise the farmer price by, he said you will get an additional 400 cedis per bag. And if you do 10 bags, that's 4,000 cedis or 4 million Ghana cedis, the old money. Now, this new price, coupled with security enhancements, that should help address smuggling of Ghana's cocoa across the border. His Excellency, the President, is also committed, right, to safeguarding the Ghanaian farmers' income while taking the necessary steps to address smuggling of cocoa. Again, at CMC, we will pursue the best market price for the nation, taking into consideration the farmer price, and we will ensure that Ghana remains competitive on the global stage when it comes to cocoa trade.
Well, let's go onto the telephone lines right now and speak to the head of public affairs at the Ghana Cocoa Board, Jerome Kweku Sam. Jerome, thank you very much for your time this evening. So what went on in the determination of these new prices? What happened?
Thank you very much for having me. And a very good evening to your listeners as well. I think that the reason that necessitated the increment basically is because the Mahama-led administration seeks the welfare of the ordinary farmer.
Jerome, kindly reposition yourself. I'm losing you.
Can you hear me now?
Better.
Okay, so what basically I was saying was that one necessitated the increment from 328 to 3,625 simply is because the Mahama-led administration is highly committed to ensuring that the ordinary cocoa farmer always gets the best. He prioritizes the cocoa farmer as against all the other stakeholders in the cocoa value chain. Look, in the determination of cocoa price, we basically look at two factors: the price on the international market as well as the prevailing exchange rate or the average exchange rate at the particular time. Now, since the announcement of the price in August, the price on the international market has been declining at a disadvantage to Ghana Cocoa Board and the Ghana government, simply because we will be losing some revenue. However, we are having or experiencing a slightly depreciation in our currency, also making us just kind of deal with the shortfalls in terms of revenue. Now, the government could have said that, okay, if we are having a decline on the international market in respect of the price, but having a slight depreciation of the currency, the prevailing price should be maintained. But because the government is always concerned about the ordinary farmer, the government decides to increase by 400 Ghana cedis. This cannot be said to be insignificant or patchy, as we have heard other NPP pundits or communicators say, because if you are having an increment on 400 Ghana cedis, at the point where the government has prudently managed the economy, we are not experiencing an inflation which would make general prices of goods and services go high, but rather stabilize prices or even cause some goods and services to reduce. This means that the value of the money that the ordinary cocoa farmer is receiving is very significant, because today the 400 Ghana cedis can purchase more than 3 bags of what? Cement.
Sam, when you increased cocoa prices somewhere in August, as you've rightly mentioned, there were concerns that it was insignificant due to the sharp appreciation of the Ghana cedi. And indeed, you have admitted that the cocoa prices on the world market is going down. So is it to say that because our cedi has been witnessing some depreciations in recent weeks, that is what has necessitated this increment?
So what this basically means that if we are having an appreciation of our currency, which means that we wouldn't be having much influence when we convert dollars into our Ghana cedis. So this should compel the government to either have maintained the price or even reduce it, as we experienced in the 2016-2017 and in 2017-2018. There was no increment because the prices on the international market had even declined. We are experiencing same. However, the government has decided to do what? To increase from 3,228 to 3,625 Ghana cedis. This can only be justified by the fact that the Mahama administration is highly concerned about the development of the cocoa farmer.
So it has nothing to do with the recent depreciation of the cedi, you say?
You see, I cannot in that sense say that it has nothing to do with the depreciation of what? Because this is a reasonable government. That knows that, okay, another side is that if we are having a depreciation of our currency, it automatically may increase the revenue that we are having.
Okay.
Even though it has an adverse effect on the economy, where it could have pushed inflation higher. But for the good or prudent management of the Mahama administration, we are not experiencing the kind of inflation which possibly would have affected the income levels of the ordinary cocoa farmer. You understand?
I do.
So the government going in to make or cause this increment of 400 Ghana cedis is something that you cannot downplay. It's something that you cannot downplay because the purchasing power of the ordinary Ghanaian farmer has not been devalued.
Some we've also been hearing from stakeholders following this announcement. For example, the president of the Concerned Farmers Association is saying that this will not be felt directly in the pockets of farmers and stakeholders if government fails to intensify its efforts to flush out illegal miners in cocoa growing areas. And also we've been hearing from the Esikafo Cocoa Farmers Association, who are also saying that purchasing agents are yet to receive funds to pay cocoa farmers starting tomorrow when they bring in their beans. So I want to pick your reaction to this quickly, both of them.
I think that in as much as I associate myself with the fact that we need to intensify to deal with the issues of galamsey, I beg to differ by saying that the ordinary Ghanaian cocoa farmer, when he receives money for the sales he makes from his cocoa, the person is going to feel the impact, the positive impact of the increment of the 400 Ghana cedis, because the person is being paid spot on. So you cannot argue that because we are having issues with galamsey, which we know that it will affect the total productivity that we expect, it cannot be argued in that sense that the farmers are not going to experience the positive impact of the increment that they have. And also, the last question happens to deal with the release of what? The release of funds.
Yes.
Now, when the minister spoke, he did indicate that the price which has been announced would take effect tomorrow. So if I give money to you today, or the money you were given yesterday, tell me, as a rational human being, how would you have anticipated that we are going to increase by this much? Hence, I'm going to pay the farmer this amount. So now that the price has been announced, and subsequently will take effect tomorrow, if after tomorrow you are not receiving funds to that effect, that is where you will have a cogent reason to say that the government has announced an increment, yet there is no release of what.
Are they receiving it tomorrow?
I strongly believe that, because today I had the opportunity to interact with the Deputy Chief Executive of the Finance and Administration, and they are working tirelessly to make sure that at least funds are being released to the license buying companies from tomorrow. So that
all right, thank you very much, Jerome Kweku Sam. He's the head of public affairs at Cocoa Board, and it's now time for business. And George Riafe is here with the latest. George, what's up?
Oh, still something coming up on cocoa, because government is promising to press ahead with programs aimed at improving the welfare of cocoa farmers after announcing that increase in every 60 kilobag by some 400 Ghana cedis from tomorrow. And the visiting IMF mission expected to end a review of Ghana's performance next week, Friday, October 10, paving way for disbursement of some $360 million to Ghana before the middle of this month. That there are strong indications that Ghana will pass this fifth review. The business news on Newsnight is brought to you by MTN Business. Welcome to the new world of business. Kingdom Books and Stationery, your number one stop shop for all your office essentials, scented tanks and Pepsodent, Herbal and Charcoal. You're welcome back to business on Newsnight. Now, government has given the firm assurance that it would press ahead with programs aimed at improving the welfare of cocoa farmers in the country. This was after it announced an increase in the producer price of cocoa by some 400 Ghana cedis per 64 kilobag. There is more in this report.
Some of these initiatives, according to government, will include implementing interventions aimed at supporting cocoa production in the country, as well as the welfare of farmers. Some of the measures will target intensifying the supply of free cocoa fertilizers, insecticides, and spraying machines. The rest are free fungicides and free flower inducers. Government believes all these measures should go a long way to have an impact on production of the beans and help in achieving our target. In addition, government will be working with Cocoa Board to also implement the new tertiary education scholarship scheme for children of cocoa farmers in the 2026 and 2027 academic year. The Finance Minister announcing this expressed government commitment to supporting the Ghana Cocoa Board to build a robust and resilient cocoa industry that provides sustainable and optimal benefits to all stakeholders. However, this adjustment will not affect margins, fees, and rates to all other stakeholders, including Cocoa Board, as government says all these margins will remain unchanged.
And that is a Business Desk report. Meanwhile, Finance Minister Dr. Atuforsen says government is committed to implementing more initiatives aimed at encouraging farmers to produce more.
We also want to bring to your knowledge that Ghana Cocoa Board will continue to implement all the interventions to support the cocoa production and the welfare of the cocoa farmer. In particular, Cocoa Board will intensify the supply of free cocoa fertilizers, both liquid and granular, free insecticides, free spraying machines, and free fungicides, and free flower inducers to the cocoa farmer. For emphasis, Government of Ghana, working with the members and the stakeholders of the Producer Price Review Committee, have decided to increase the cocoa price by 400 Ghana cedis per bag. I so submit.
And that is the Finance Minister, Dr. Atuforsen. Now, Ghana has secured some 3 billion Japanese yen grant from the Japanese International Cooperation Agency to overhaul the inner ring road in Kumasi. An agreement was signed today between the Finance Minister, Dr. Atuforsen, and also the officials of the Japanese International Cooperation Agency here in Accra. Let's hear from the Minister of Roads and Highways Governance, Kwame Agboja, who revealed that this should bring some relief to motorists in that area.
The President of the Republic is determined to reverse the situation on our roads. The average person in our country is unhappy with the road near them. That is why, through his Finance Minister, my brother, has extensively to improvement on the road network in our country. Indeed, Kumasi is a very strategic town, city in our country, and the traffic situation is such that when you're moving from the south to the north, the obvious route currently is going through Kumasi. And the delays and the loss of productivity that everybody suffered by going through Kumasi needed to be addressed, even if you were just driving around Kumasi.
Governor Kwame Agboja is the Minister for Roads and Highways. Now, the visiting IMF team assessing Ghana's performance under the fund program for the 5th review should bring their work to an end next Friday, that is October 10, 2025. The team has already met the Finance Minister, Dr. Atuforsen, and the Governor of the Bank of Ghana, Dr. Johnson Isiama. Now, answering a question posed by Joy Business Director of Communications at the IMF, Julie Kozak, said the team should come out with their verdict on Ghana's performance at the end of the review.
As you alluded to, we do currently have a team on the ground in Accra for the 5th review under the program. The team is with the authorities and other stakeholders. Obviously, the team is going to be assessing progress made, continued progress made under the program, and they will, the mission will conclude on October 10th. So I don't have much more to add regarding those discussions, but we would expect, of course, the team to communicate in due course.
And that is the IMF Communications Director, Julie Kozak, speaking at a news conference in Washington, D.C., USA. Now, based on this development, Ghana is likely to get some $360 million disbursed to the country. That should hit Bank of Ghana's account before the middle of this month. Now, this is what we picked from sources close to the engagement, as Ghana is likely to pass this 5th review. Two other stories. The Acting Director General of the National Development Planning Commission, Dr. Audrey Amoah, has expressed renewed commitment in the Affirmative Action Bill. Dr. Amoah made these remarks at the official launch of the Toolkit for Mainstream Gender Responsiveness in Planning, Budgeting, Monitoring and Evaluation Program in collaboration with the German Development Agency GES and the Ministry of Gender, Children and Social Protection.
This process gives us a fresh motivation to commit to the conscious implementation of the Affirmative Action Gender Equity Act 2024, Act 1121. It moves us from the what to the essential how to. It provides our dedicated planning officers, budget analysts, and gender desk officers the step-by-step ways to analyze gender issues and incorporate them in the planning process, including monitoring and evaluation.
And that is the Acting Director General of the National Development Planning Commission, Dr. Audrey Amwa, speaking about the Affirmative Action Act that has already been passed by Parliament. Nestle's Maggie Ghana's trusted cooking partners awarded 30 lucky winners in its grand final of the Double Chop promotion. Now, speaking at the Deborah to award these winners, Deborah Kobler, Corporate Communications and Public Affairs Manager at Nestle Ghana, said the promo, which ran from the 1st of May to the 31st of August, was aimed at rewarding loyal customers of Maggie.
Maggie organized this promotion because we believe, and it is actually our firm belief, that consumers make the brand. And so the consumers of Maggie are the ones that make the Maggie brand. And they are the reasons we continue to produce Maggie. So this double chop promo is to give back to these same consumers who make the brand. It is their brand, and so it's an appreciation to these consumers to say thank you for being a Maggie customer, for being a Maggie fan, and continue to be a Maggie fan because we think about you beyond the brand. And that is what we have exhibited today.
Deborah Kabla is the Communications and Public Affairs Manager at Nestle Ghana. Let's turn our attention to the stock market. If you are a shareholder of Gold today, each share that they are holding was up by a peswa to close at 2 Ghana cedis, 45 pesos. EcoBank also saw some significant jump in the price of each share that one is holding, and actually was up by 1 Ghana cedis, 20 pesos, and is now worth 13 Ghana cedis, 20 pesos. If you had also invested on the market from the beginning of this year to now, you've made more than 70% return on your investment on the Ghana Stock Exchange. And for PM Express Business Edition tonight, we're talking about petroleum prices. And if you study the trend, it's going up. What are the implications for you as a consumer? We are engaging all those who matter in the industry, from the NPA, from the Chamber of Petroleum Consumers, actually also from the Association of Oil Marketing Companies, and also the bulk oil distributors as well. All these issues wrapped up at 9 p.m. as we talk about fuel prices going up, impact on consumers, and the larger economy. And also on all our social media platforms at 9 p.m. tonight on PM Express. And it's time for sports, and I call him Invitational. He's in studio.
And I call him the IMF Country Director. Otoado has assembled his squad for the final round of the World Cup qualifiers. That will be happening on October 8th and 12th. So Jordan Ayew is leading his group for these matches. So Lawrence Atizige, Benjamin Asari, and Joseph Annan, 2 home-based players have been called up. Benjamin Asari, and the other is Prince Owusu of Midiama SC. Ali Risedu makes a return to the team, having been out since last year. There's also a place for Abdul Fattah Isagu, who got injured during the African Cup of Nations qualifier against Angola late last year. Yes, this Gideon Mensah, Mohamed Salisu, Jerome Opoku, Kojo Prepra Opong, Caleb Renchi, Jonas Ajete, Ebenezer Annan, and Alexander Jiku. These are the defenders. Elijah Owusu, Thomas Partey, Kwesi Sibo, Prince Owusu, and Mohamed Kudus. They make up the midfielders. Abdul Fattah Isaku, Joseph Pinsel, Christopher Babonsu, Kamaldeen Suleimana, Jordan Ayew, Iñaki Williams, and Antoine Semenyo are the players who have been called up. The players who assemble between 4th and 6th of October. The game against Central African Republic will be happening on Wednesday, 8th October, and we'll have commentary on this network.
We wish them all the best. Thank you very much, Muftau, for bringing us the latest in sports.
We are dying of hunger. We can't pay our medical bills. We are dying. JM, pay us now. Pay us now. JM. JM.
And in a desperate bid for relief, the coalition of unpaid nurses and midwives today marched through Accra streets demanding immediate payment of their 10-month salary arrears. Over 7,000 nurses and midwives recruited in December 2024 have worked without pay, sparking widespread frustration and demoralization within the healthcare sector.
Well, the demonstration began at the Afua Sutherland Children's Park, winding its way to the Ministry of Finance and the Ministry of Health, where petitions were submitted. Protesters clad in red armbands and wielding placards expressed their desperation and frustration with the government inaction. They spoke to my colleague Jacqueline and Somaya Boa.
Payers. We've been working for 10 good months, no salary. Personally, my rent expired in 15th August. I've not been able to pay. My landlord is always asking, when are you paying? I'll be like, they'll pay us, please give me time. I stay at Spantine. I wake up Kolebu. I take transportation, 42 cities to work every day. How do they expect me to get that money to come to work? You bath patients, you attend patients every 4 hours. I'm doing all this just for the minister to tell me that he appreciates the work that I'm doing. Appreciation, babe.
Right, and their first point of call was to the Finance Ministry, where they presented a petition to government. Receiving the petition on behalf of government, Deputy Finance Minister Thomas Ampem Nyako says although government has already begun working on their demands, there are no clear timelines on when the monies will hit their accounts.
I don't understand.
Your issue is being addressed. There are a lot of legacy challenges that we inherited, and we are working earnestly to fix all of them. In the next month or so, the finance minister will be in parliament to present a new budget. Issues of health workers who have not been paid, not just you, there are even some doctors and others are seriously being considered, and you are going to receive your salary. We appreciate the work that you do for Ghana. And I'm sorry for those of you who are not even well, but have had to walk all the way to here, to this place, to present this petition. It will be given the needed urgent attention, as you have stated.
We can also listen to the Minister for Health, Kwabena Mintah Kando, when the group met him too at the Health Ministry.
I have family members who are going through the same ordeal.
But not yourself.
The truth of the matter is that we inherited 13,500 of you being recruited without any financial provision. Now, out of the 13,500 people, more than 7,000 to 8,000 of them have been processed and they are receiving salaries. Now, we have about 6,500 of you whose documentations are still being processed. What I can tell you on authority is that we appreciate the challenges you are going through, but we as a Ministry of Health will continue to work closely with the Ministry of Finance until all of you are paid.
Right, so you heard the Minister of Health, Kwabena Mintah Kando, addressing the unpaid nurses. Well, let's take you to Parliament now, because the minority in the House is turning the heat on Communications Minister Sam George, accusing him of deceiving Ghanaians with what they describe as a sham DSTV price reduction. Or Deputy Ranking Member on the Communications Committee, Charles Oredu, says the minister's much publicized promise of a 30% cut in subscription fees has collapsed into nothing more than a repackaged multi-choice promotion.
Just yesterday, MultiChoice released a new statement clarifying that breakthrough the minister announced during his press conference as a result of his effective negotiations. In fact, they said what they were giving Ghanaians were merely promotional offers. This clearly aligns with what we stated in one of our earlier press statements. It is also demonstrated that the minister lacks the temperament and emotional intelligence for such a critical role. He has demonstrated this same trait on numerous public utterances, insults to citizens and industry players during the process. By adopting an arbitrary decision-making posture, the minister is also denying regulators, such as the NCA, the opportunity to perform their work according to law, which clearly threatens the growth of this sensitive industry. Fellow Ghanaians, for this display of ineptitude, incompetence, and penchant for deceit, we of the minority demand that the minister render an unqualified apology to Ghanaians for the waste of the nation's time and resources on this venture. We call on him to account for the fines levied on DSTV.
And Pearl, before we go, we have one final story for our listeners.
Well, the Ghana Education Service has taken swift action against a teacher at the Okadjakrom Senior High School in the Oti Region in Fort Richard, Tibeto, by interdicting him over alleged sexual misconduct with a female student. He has also been prohibited from entering the school premises pending investigation into this matter.
That's definitely a developing story we will be following through to the end. And that's it for News Night tonight. Thank you very much for being a part of the show. My name is Kenneth. Gyasi.
And my name is Ofori.
Have a good evening.